If you're a pediatric therapist, and you probably already know that applying evidence-based practices to your therapy sessions can be kind of challenging, especially if you have a big caseload and if there's a lot of research out there to sift through. What is even more confusing is being able to distinguish clinical judgment from confirmation bias. So clinicians have what's known as the evidence-based practice triangle. And so that means that we can pull from a number of different sources to make sure that we're following ethical practices and we're doing things in line with scientific research. So, for example, there is the evidence component of the triangle, which just means that we're pulling information from things like peer-reviewed journals. There is the client perspectives part, which means that we are taking the client perspectives and their cultural background and their unique situation into account as we're applying the research to our practice. And then there is the clinical expertise component, which just means that we're using our knowledge and skills from past experiences to make decisions in therapy. And where this often gets heated in a lot of the discussion groups is that people will say, here's what the research says. And then someone else will come in and they'll say, well, but I'm using my clinical judgment and my clinical expertise, and I don't agree with what that research says. And then things go back and forth and it gets ugly. And I'm sure that you've probably seen that if you are a clinician and if you've been in any discussion groups. And a lot of these discussions come up because people don't fully understand what it actually means to use that clinical expertise component and apply that to your practice. So, for example, I am a speech language pathologist, and speech pathologists have some evidence maps on the American Speech Language and Hearing Association's website. And the evidence maps give us information about different topics relating to speech pathology, and it gives examples of the client perspectives angle on different topics, as well as the evidence from peer-reviewed journals and things like that. And then finally, it gives some examples of clinical expertise. And all of the examples under clinical expertise refer to processes and systems. So for example, it might say something like you're using a case study to collect information about the client's environment. You're using a variety of standardized and non-standardized assessments to make decisions. You're doing interviews and interviewing all of the stakeholders. So it really talks more about the processes. So using your clinical judgment and your clinical expertise isn't just about stating your opinion. It's more about having a good process. So that's where some of the disconnect happens. So the way that you want to make sure that you are applying that component of clinical judgment is not just about stating your opinion and things like that, because as you know, it's really easy to get caught up in confirmation bias and just, pull information that you think is relevant to back up what you're saying. What we want to do instead is have a good problem-solving process to make decisions. And that's a good way that you can tease out when you're talking to other people if they're truly using their clinical judgment versus if they're getting stuck on their ideology. So for example, something that you could ask them is, how do you make a decision about that when you have a client and there's a very unique case and it's not quite all of the things in your toolbox aren't quite working out? How do you make a decision about how to serve that client? So that's a way that you can kind of tease it out. And that's how you can actually apply the clinical judgment aspect and the clinical expertise aspect to your practice. It's not about your opinion. It's more about your problem-solving process and how you pull together information to make decisions.